Hey, welcome everyone to the Long COVID Web Town Hall meeting. Thank you all for joining us today. You will see the meeting agenda on the screen for now, and we will also post that in the chat for your reference. And before we begin, just a few quick housekeeping notes. Please keep your cameras and microphones off throughout the session. And if you have any questions, feel free to post them in the chat at any time. And you can also mention the speakers if you have any specific questions for any speakers. We will do our best to respond there in the chat, and we will also have a Q&A session at the end to address any that remain. Please note that this session is being recorded, and by attending, you are providing the consent to the recording. And with permission from our speakers, the recording will be made available online after the event. To start us off, we're honored to begin with a land acknowledgement from Fawaz. She's our Long COVID Web's Indigenous Engagement and Patient Engagement Specialist. Over to you, Fawaz.
Thank you, Karen. Hello, everyone. Welcome. I'm located in Calgary and I will be doing my land acknowledgement from Alberta. Calgary is located in the heart of southern Alberta and it both acknowledges and pays tribute to the traditional territories of the people of Treaty 7. This includes the Blackfoot Confederacy, composed of the Siksika, the Piikani, and the Kainai First Nations, the Tsuut'ina First Nations, and the Stoney Nakoda, which includes the Chiniki, Bearpaw, and Goodstoney First Nations. The city of Calgary is also home to the Métis Nation of Alberta, Districts 5 and 6. So let's acknowledge the land that we're on, where we are respectively as well. Thank you.
Thank you so much, Fawaz. So the first item of the agenda is on the long COVID web updates. We'll hand over to Dr. Angela Chen, MPI of Long COVID Web.
Hi, welcome everyone. Good to see you all. Karen, if I can have the slides up, that would be great. Thank you. So we are 2.5 years in, and there's a lot happening in the long COVID world. Even recently, thank you. Even recently, our group was at the pandemic preparedness meeting, which is an international meeting. It was meeting in Alberta, and so Dr. Doug Brose and Dr. Maxi Miciak actually represented the long COVID web, and then we also have a patient engagement session that was actually done by Fawaz and also Chris, our patient partner, and Nandini, our patient partner as well. So as of a couple of days ago, so June 3rd, 2025, we have a total membership of 1124. And so over the last year, it's 111 new members, and you can sort of see the split. We do have a lot of long COVID patient partners, about 622 of them. And you can see on the graph on the right that, there are researchers, clinicians, health policy decision makers, and various people as well. They do come from across Canada, but we still don't really have anyone from the New Territories or the Northwest Territories. So there are a couple of territories that we actually are missing representation. We're working on that, and you have seen this graph before. We do try to increase diversity of our web as well. And you can see that there are more women than men. 78% are women, and even though long COVID affects men as well, You can see visible minority and racialized minorities consists of 14%. Indigenous peoples are still quite low at 3%. Those are some of the breakdown. Next slide. So we did a annual review, and there's a report. So I'm not going to go into it in detail. You can find it on the website. So it's the 2024 year in review. So it has an English version and a French version. Take a look. It has detailed descriptions of what we have been up to. Next slide. And up to now, we have funded 48 projects over the last couple of years. Some are looking into why people have long COVID, so the pathobiological studies. There are 8 interventional studies, and we actually have a couple more that wasn't counted in the 8 interventional studies because they go under the mixed or multiple method studies. In terms of like management treatment studies, we probably have about 12. And we have about 8 observational studies, including some that are in certain marginalized populations, and 8 qualitative studies. And then there are 14 that have used different methods. Next slide. I want to remind everyone about our annual symposium. It's going to be October 20th to 21st this year in Newfoundland, St. John's, Newfoundland. It's a beautiful place. So it's co-hosted by the Memorial University group, and hope you can join us there. Next slide. Oh, registration, I don't think the registration is open yet, but keep an eye out for it. And abstract submission is done. It closed, but registration will be coming. Next slide. Oh, it says registration open, so yeah. Next slide. Because of the large number of patients in our network, we are trying to have people have opportunities to participate. Other than the PAC, you'll hear an update on the Patient Advisory Council. We are also working on having different working groups as well. And similar to sort of the research network collaboration, so, Long COVID Web is kind of a network of networks. There are multiple networks that are connected to Long COVID Web. And so we are going to set up something on the patient side as well with different networks. There's an opportunity on that area, but also we would like to open for additional members on the Patient Advisory Council. You will see a call for interest in a couple of weeks, and we're going to open it until the end of July for submissions. So just to let you know about that as well. Next slide.
That's the end.
Oh, okay, great. So I want to pass it over to Maxi to talk about sort of the impact of our web. Maxi.
So what we've done, just a review of years 1 and 2 really briefly. So in year 1, what we were trying to do with impact and impact assessment, and let me backtrack a little bit, just as a reminder, when I'm talking about impact, what we're talking about is the effect or the difference that Long COVID Web is making. So the difference that the web is making on developing a network, developing relationships, and how those relationships and the things that we're doing are actually having an effect on people living with long COVID and their caregivers. And so we want to be able to assess the impact that we're having. And so in the first year, we really wanted to lay a foundation for doing that. As you can imagine, when you think about it, it's complex. A process, and it can feel overwhelming. So we really wanted to make sure we had a strong foundation for evaluation and assessment. So we did a lot of planning. We developed an impact framework, a logic model. We identified some potential indicators. We also spent a lot of time developing our data sources and how we collected data for that assessment, and what kinds of questions that we wanted to ask in terms of impact. At the same time that we were doing that, because we were building the web as we were flying, so to speak, we were able to embed different elements of impact throughout the web. So, for example, embedding impact into our seed funding applications, and also engaging with our Patient Advisory Council. So that was year one. In year two, we looked at refining and expanding what we were doing in terms of impact assessment. So we're always annually looking at refining our frameworks, our models, our preliminary indicators. Is this actually what we're assessing? And is this actually what is important and relevant to assess? But also looking at how we actually wanted to assess the impact of a network. And in doing that, we've expanded our analysis. So really happy that we're able to provide a more comprehensive perspective on how we're advancing long COVID knowledge, but also how we're accelerating knowledge mobilization. What are we doing in year three? We're moving not from a monitoring, which is what if you look at the annual reports, that's what we're doing there. We're monitoring, and we're starting to elaborate on the impact of long COVID web. But we really want to develop a formative assessment to be able to take a deeper dive into what is the effect that the web is having. We're looking at tracking the state of the science so that we can situate long COVID web's impact within Canada as well as internationally. And we're also integrating new initiatives that have come on board. So our ECHO program and our Indigenous initiatives. Key successes and challenges to date. I think that, a huge success has been really being able to establish a foundation for impact and impact assessment. And it's allowed us to be able to, I think, provide comprehensive annual year-end reviews. Assessing relationships and knowledge mobilization right from the beginning has been crucial, and also expanding our ability to track how we're producing knowledge. Challenges have been trying to keep track of everything that is going on in relation to impact with a network. There are a lot of moving parts, and it's complex, but that challenge is one that we're taking up. And also planning for a formative assessment is a big initiative, and so that's getting that going has been a bit slower than I'd hoped, but we're moving nonetheless. And that's our impact update on impact.
Thank you so much, Maxi. We'll turn over to Vishaka to share the website updates.
Yes. Hi, everyone. My name is Vishaka, and I am the comms officer for Long COVID Web. I apologize. I think someone's turned on a vacuum cleaner in the hallway, so I hope that's not bothering, and I will share my screen. Yes, so here is my screen. So today I'll just be sharing some updates we've made to the Long COVID Web website. Some of the intentions behind this website update was to make it more easier for audience members to find resources, to stay connected, learn about upcoming events, and also just find out how to participate in current opportunities. The first thing you'll notice is that we have this pop-up for the upcoming symposium, which I'll talk about a bit more as we go through the different pages. So I'll just close that right away. So what you can see at the start is that we have a join LCW button. This is for anyone who wants to join the membership. You just have to select that button, and then there's a registration form that you can fill in, and then you'll be added into the membership list. So first page, it's very simple. We had this content before. We just make sure to update our scrolling. We have this scrolling update section where you'll be able to find out new information. And then also just an overview of our key pillars. In our menu basically identifies our key areas, and I'll go over them. In resources, so in this list, we have our trusted resources. This is a list that's divided into 5 categories to address key needs for all of our audiences. So you can just go through all of the lists. So they're just drop downs, and you'll be able to go through all of the list. The latest update, if I'm not mistaken, was done earlier this year, and we do update this list as and when we get new resources, or if someone submits a new resource. We also link this page to the trusted resources in our monthly newsletter. So that's another way that you can access this page and find out if there's some help or some resources that you would like to gain access to. In our next section, it is research. So in the main research page, we just have an overview of what is currently in process. So we can see our 2025 seed funding call. You can view past results, and then also current engagement opportunities and published studies. These 4 or these 3 lists or these 3 resources are also mentioned as part of the menu. So if you go into published studies here, you'll be able to see a list of all the latest studies, and our team aims to keep this list updated. We also have research engagement. This is if you want to publish a study to be able to recruit for it. You can just select this button also to submit your study. And you can also let us know if you would like to promote your study in our newsletter, which we have been doing. And then we'll also go over to the research funding opportunities. So the main thing is the 2025 call for proposals. That deadline is July 4th. If you select that button, you'll just be able to get all of the details for how to apply, the eligibility, and the application form. Next, we'll go over to events. So we have a list of various kinds of events at Long COVID Web. So the first one is just the homepage for that, where, as you can see, we have information about today's town hall, and then you can also learn about past events if you scroll down. The drop down also indicates that we have webinars. So our upcoming webinar is June 17th, and you can watch all of our previous webinars. These are all YouTube links to them. And then if you select each link, it'll just give you some information about what the webinar was about. We also have a dedicated section for the Long COVID Echo initiative for healthcare providers. So yeah, this just provides some information about what the next sessions are. And we also at the top and at the bottom, we also link to a French language echo, which is on behalf of our long COVID colleagues in Quebec. So if you did want to find out more information about that, that is on our echo page. And then also, I won't go through all of these, but as Angela mentioned in the start, our year in reviews are in the About section, and you'll be able to view them in English and French for 2024 and 2023. And then, lastly, if you want to contact us, please, let us know. You can either contact us at our on our email address or fill in this form. And that's it. Oh, I'll just quickly show you the 2025 symposium as well. So this page has all the updated information regarding our symposium. Registrations are open, and early bird pricing for tickets ends tomorrow. And we usually will have updates on social media and newsletters, which will link back to this page. And I think my time's up, so I'll stop sharing. Yeah.
Thank you, Vishaka. And so we'll move on to the research pillar updates. The first one is from biomedical research, Gavin.
Okay, great. Yeah, so good to be here, and thanks for the opportunity to present on our pillar one, so our biomedical pillar. So really driven by four of us: Leanne Falcone from Montreal, Jim Russell from Vancouver, and Manelli from Hamilton, and myself from Edmonton. So I'll start off with, so the theme of the update today is really inflammation and its role in long COVID. And so I'll just start off 2 slides here, each from each of us. So this is work from Liana with her important host microbe interactions and the role of the intestinal barrier in long COVID. So the microbiota, Liana shown to be a key role in long COVID, looking at her cohort, and not only in acute setting, but all the way out to 12 months. So very interesting follow-up and some really nice pathophysiologic mechanism linking the microbiota with immune dysfunction and autoimmunity and end organ damage. So Liana is in the process of submitting manuscripts and having these published. She does have one patent filed and is actually looking at a therapeutic avenue based on her discovery. Liana is also a big part of the RECLAIM study with Angela Cheung group, of course, the leader of the long COVID, and part of our group with the taurine study here being led from Edmonton. So that's very interesting, and lots of impact there in the intestinal microbiome. As you know, ACE2, the central receptor for the SARS-CoV-2 virus, is mainly expressed in the gut. So just along that theme, so this is work from Jim Russell in Vancouver with his Captivate study. So this is looking at cytokines and chemokine levels and the progression from acute to long COVID. And Jim has a special interest in brain injury and this inflammatory response. So they have looked at recruit patients from both the acute and the long COVID in the BC long COVID clinics and look at these inflammatory markers. And they correlated these with patient reported outcome measures of PROMs at both 3 and 6 months. And what they're able to show that 7 cytokine and chemokine levels did not change from admission to 3 months, 6 months, suggesting sustained inflammation for 6 months. So this is really a strong overriding theme now from our group and multiple other groups globally, that persistent inflammation is a big part of the story. And there are some of the biomarkers, interleukin-1 beta, platelet-derived growth factors, and other inflammatory chemokines are linked to decreased quality of life at 3 and 6 months, especially in women, which is women are affected 2 to 1 compared to men in terms of long COVID. And so this cytokine signature may predict outcomes in long COVID, in particular in women. So related to this, Dr. Manali Mukherjee from McMaster in Hamilton has a very strong interest in immunity and a particular focus on autoimmunity. So things flare up in rheumatological conditions. So this has been her focus on the respiratory side and linking these to pro-inflammatory cytokines and some of the more autoimmune antibodies like anti-SSB antibodies. And so she's recently published that in European Respiratory Journal. And then now she's looking at other mechanism, netosis, and other autoimmune mechanism driving mainly the rheumatological manifestations of long COVID, with a particular focus on B cell dysregulation. So the macrophages and T cells have received lots of attention, but the B cells, which produces the antibodies, are a big player in autoimmunity and may drive some of those autoreactive antibody production. So lots of publication here also from Manali, and oral and poster presentations. So lots of trainees involved. So that's always great to see. And then finally, this is work from our group where we did very complex single nuke RNA sequencing biopsy samples from patients who had COVID, looking at the inflammatory response in the heart. And 2 of these patients were also patients with MIS-C, so 2 adolescents. And this is a complex slide, and we can chat more about this when we meet in person in October and elsewhere. But what this is showing there, and the bottom right, you can see the middle panel. There's all those circles lit up. That's COVID hearts. So those are patients with acute COVID. Lots of inflammation, both from lymphoid, but also from myeloid. So macrophages and neutrophils are dominant, and a key involvement of the microvasculature. Okay, so the endothelial cells, the pericytes are dominant in COVID, and that's an important message here. Interferon gamma is the dominant inflammatory cytokine we see as a key mediator, and this is now correlated in our data from our animal model work. Interferon gamma is a dominant cytokine that helps to combat acute and long COVID, and this is seen when you look at the tissue from patients with acute COVID myocarditis. So very interesting, very complex work that was done as part of an international team being led from our colleagues from Germany. And those are the updates I have to share. I'll stop sharing here.
Thank you so much, Gavin, and we look forward to also hearing more in the later sessions. Thank you.
Great, thank you.
Yeah. And if you have any questions for any speakers, feel free to put the questions in the chat, and we will take a look at them there. For our clinical updates, we will be having a webinar on June the 17th with some clinical trials update and also using clinical risk scores to predict post-COVID condition. Please stay tuned for an announcement that's coming out very soon this week. So the next one is for the third pillar, health services research. We'll turn over to Dr. Naveed Janjua.
I would like to start with the land acknowledgement. I'm joining from unceded traditional and ancestral territories of Coast Salish people, Musqueam, Squamish, and Tsleil-Waututh nations here in Vancouver. Goal of our pillar were to develop validated case finding algorithm in healthcare administrative data sets, and then to enable national and population-based study of healthcare delivery and outcomes to identify gaps and improvement in care. So I will provide updates related to that. So first project within this context is a national data atlas, which tried to collate information on cohorts where clinical data was linked with the healthcare administrative data sets. So this summary has been compiled, and it's under review at Canadian Journal of Public Health. With respect to the actual algorithm, we developed this algorithm previously, and then we were trying to refine it so that it could be utilized and be applicable in other settings outside of BC. So we have been able to come up with a model with same characteristics, but fewer variables, which could enhance its portability across Canada. And this model has been now validated and available. With respect to some of the other components related to model development, we were also doing a survey to enhance the population that was contributing to model development and validation, especially recruiting individuals who do not have more severe disease, and then apply that to the model. In addition to that, we are working on finalizing the documentation which could make the model easily applicable in other provinces. Manuscript finalizing this update is also ready and about to be submitted, and model is currently applied in Ontario. And then we have work in progress to bring validation in other provinces. The next project is looking at long-term outcomes. There are three major areas in which our core has been working on. The first one is some additional studies looking at post-acute diabetes risk and risk over time. Main question was whether there is a change in risk over time, and we found that over time risk declines, and there is a lower risk among individuals who received vaccination. So this manuscript is also under review. Then the second part of this project or studies was looking at neurological outcomes. With that, we saw, similar to other studies, there was increased risk of various neurological outcomes, and risk is lower among those who received vaccination. We were also looking at post-acute myocarditis. Initially, a lot of studies looked at myocarditis following acute infection or vaccination, but this is post-acute or long-term myocarditis risk following infection, and we found that the risk of myocarditis is higher post-infection. Healthcare utilization, which was one of the key objectives. We in BC, we have updated analysis extending it to the 2.5 years and 3 years, and which showed that the overall healthcare utilization has declined over time, but it's still higher among individuals living with long COVID compared to controls or their background rate pre-COVID. A paper summarizing the cost of illness has been published from Ontario, and there is an analysis in works in BC looking at costs related to long COVID. In terms of future plans, we are planning to make this algorithm available across for application across Canada, and ongoing recruitment of for survey to enhance the population, especially focusing on racialized individual, and then analysis of survey data, and then additional analysis using the algorithm. So I will stop here, and thank you very much.
Thank you so much, Naveed. There are some questions in the chat. I will invite the speakers to take a look, and we can also come back to it after all the speakers are finished. So our next speaker is Dr. Ellen Rafferty to talk about the update of the population health research.
So yeah, I just wanted to give a brief update on Pillar 4, which is focused on harmonized response to personal, societal, and economic impacts of long COVID. And we have 6 ongoing research projects that I just wanted to highlight in case there's interest in engaging on those. So the first one is our foundational project, which is looking at developing a consensus-based minimal data set to access long COVID, and that's being run by Gary Group, who is my co-pillar lead, but wasn't able to join us today. We also have work ongoing on learning best practices from integrated care models for long COVID in Canada, and one on associations between chronic health conditions and long COVID symptoms and the role of vaccination status, which looks at data from the CCHS from Statistics Canada, and I think that project's just got off just started, and a project run by myself on the socioeconomic and healthcare impacts of post-COVID-19 condition in Canada. And this is using a survey out of Saskatchewan that we're expanding to different provinces, and really expanding what we look at when we look at the costs associated with post-COVID conditions. So some around healthcare utilization, but outside of not just within the publicly funded system, but other costs that are direct payer or through insurance costs, as well as looking at the broader socioeconomic impact. So caregiver costs, productivity costs, those estimates that I think can really impact those with PCC or long COVID. Julian Little, who I also work with on the impact of PCC condition on the Canadian healthcare workforce. And they developed a living evidence synthesis as part of a CIHR grant, and this is continuing that work to be able to fully understand the impact that PCC has on the workforce, as well as continued work building an agent-based model that simulates the impact that COVID-19 and post-COVID condition can have on the workforce, especially the healthcare workforce, as I know we're all concerned about. And then finally, a project identifying the experiences and needs of Fort Smith Métis with long COVID being run by Gary Groot. So if anybody has any questions about any of those projects, feel free to reach out to me and I can put you in contact with the different PIs. In terms of areas for future research that I know are highlighted as part of the call, but in our area specifically, there's still a need to estimate the healthcare, societal, and patient level costs associated with PCC. I saw that what Naveed just presented, so I'd be really curious to hear more about those cost estimates to see what they have included so far. Some of the ones that kind of came up, maybe not as initial priorities, but have become more important, is that impact on the workforce and return to work or sustained work strategies. I think this is a real big focus and an important focus, and it's really important for long COVID, but also I think has become a concern across a wide range of chronic conditions. And then one I haven't seen a lot of work on that could be very interesting is the impact of long COVID on health-related quality of life. So not just the economic impact, but the impact on people's quality of life. And so that is it. We have our ongoing pillar meetings happening quarterly, and we have a panelist presenting at the upcoming Long COVID Web Symposium. And yeah, happy to take any questions.
Thank you so much, Ellen. And Navi also posted the answers to the cost of illness in the chat. So we will move on to the next one is from the Patient Advisory Council update. Chris, over to you.
Hi, everyone. Thanks for having me. My name is Christopher Drozda, and I'm a person with lived experience long COVID for almost 3 years. So, it's been great because it's just about 1 year since I've been on the Patient Advisory Council. So first, I thought I'd maybe just describe a little bit of what the PAC is for people who haven't heard too much. So we're essentially 8 to 12 members from diverse backgrounds. We're people with lived experience in terms of long COVID, but also I want to emphasize that we're also caregivers as well. And we also have a parent as well. So thanks to Dr. Cheung about that call out about looking for more patients to be with us in the PAC. That would be definitely, we're looking forward to that. So what I'll probably do is talk a little bit about some of the things that we actually do and what we've highlighted a couple things in the last few months. But essentially what we do overall is we provide input regarding long COVID research where the members can systematically review research materials, provide critical insights from a lived experience point of view, and contribute to shaping the research priorities. So patient and family-centered studies, and also in knowledge mobilization. So I guess what does that look like in sort of real life? And I'll highlight a couple things that we do. Every year, what we do is we help out with the symposium abstracts. And us as patients, we do have input, and we do provide feedback on those applications, as well as a big highlight is the contributions that us patients will do with the seed funding research grants as well. That is very much a key, and actually probably a highlight of that, because we do have a good input into where the research dollars go. And I think one thing I will sort of highlight that was brought into as well is that the research grants in terms of how PEM, post-exertional malaise is affected within that research as well, that we would like to make sure that is highlighted in research grants. So those are sort of the key parts that we do. The other really big one that is happened over the year is the contribution to the creation of trusted resources that was highlighted earlier on the website. That is a real must for everyone, and probably get it out of there. That was a lot of work that was done with various different people in the pack and everything to try to sift through lots of resources that try to put on there. And those trusted resources are for patients, for family caregivers as well. So those are very, very important. Some of the little things some of the things that sort of happened very recently, I want to add as well. Well, one big thing is in the symposiums, we provide basically the core of trying to develop and help out with the symposium management and creation of that, which will include like a patient forum. But also a big highlight actually is the artwork that has been provided over the symposiums. And I'll add that researchers have given us great feedback in terms of the impact that people with lived experience have provided in their art, whether poetry and that to just sort of give that on the ground sort of impact with not just us, but the researchers as well. And we really appreciate all of those hard work from the pack and from the artists that provided that. The other thing I think I'll talk a little bit about is we've sort of also provide various different, in the last little while, I think I want to highlight actually first off the echo. We do have a patient representative for that long COVID echo. I think this is an incredibly really good first step into providing credit, medical education credits to healthcare professionals to learn a little bit about long COVID. And we also have a patient representative on there and two wonderful doctors, Dr. McKay as well as Dr. Anise, who are sort of heading that. So I invite people to sort of look and forward those to other healthcare providers to begin that sort of process of sort of a grassroots sort of situation of communities of practice within the medical community to learn about long COVID and also the presentation of case studies as well. So, which is very, very important. And finally, even within the patients, we just did a presentation at a Banff conference that was looking at pandemic evidence collaboration, or looking in the review mirror, success, failures, and unintended consequences of the pandemic. So thank you to Farwa and to Nandini and to myself that we're providing that information to a group that is a little bit outside of all of us. And as patients, knowing that future pandemics are going to be where you're going to get the information is going to be from the lived experience of the patients themselves that have been affected. So it was nice to see the kind of get out of the box a little bit and go into a slightly different area on there. So I think that is everything that I have, and I probably have about 10,000 more things I could provide, but maybe there'll be some questions that'll prompt my my cognitive dysfunction memory to remind myself about all the other things that are happening as well. So thank you.
Thank you so much, Chris. And we look forward to all the future work with the PAC. And a question came up with the how to connect to the patient advisory group. So we will be making an announcement soon. So last but not least, turned over to Keenan for the Indigenous update.
Perfect. And Karen promised me half an hour, so we got loads of time. I actually was going to present another way, but I'm going to completely change my mind. So to my partners, apologies in advance. The Indigenous stream in this work we've always known, has to overcome a trust barrier. And there's historical components based on, and I've learned actually a lot about the origins of vaccine hesitancy when there's an issue of historical experimentation and touch points. So there's been a valuable learning with that component. However, I want to recognize this group and everyone that presented before me because it changes our job, Farwa and our job, from, hey, we want to do something with or on you, which is the fear of any helicopter researcher, which is not what long COVID web is at all. Rather, and compliments to the previous presenters, we get to say, look at this website, and oh, you wanted to do bench science? We've got this. Or oh, you want to do population health or real research, or just supporting younger people. So that has been a great benefit. The next step is bringing it to the SUC committee. The acronym, it's the Support Unit Council, SSUK, but we specifically have a national Indigenous community of practice. So we've had a relationship with this before. We're bringing all these opportunities forward. And that's an opportunity for patient engagement and Indigenous voice representation. Our starting point this summer will be with the BC SPORE. And then part of that is based on realities of our communities. The prairies are experiencing significant wildfires. So out of respect and appropriateness and capacity, we want to, everyone's invited, but we'll limit level of effort while people are in states of summertime emergencies. And as well, it's summer ceremonies for depending on the region and territory that we're at. So that serves both an opportunity in terms of gaining credibility and entry into Indigenous communities. However, also appropriateness about when was it appropriate to say, hey, long COVID and bring out your folks. So how these things go in my experience are we give updates like this of we're having conversations, we're getting the word out, trust us, and then 1 month we'll be back and say we now have a dozen different things going on and fundamentally relationships move at the speed of trust. So long story short, the opportunity for Indigenous representation, voices, and being infused throughout long COVID web is actively occurring. And the simple matter that we're keep coming back consistently, and there's consistency in this leadership team. I'll also say specifically, Angela, the fact that everyone knows that it's you and me and Farwa, and it's been that way for a couple of years now, that actually gains a lot of street cred and separates long COVID web from being a helicopter study us to death type researcher. So that's our update. Thank you.
Thank you so much, Keenan. So we have a couple of questions in the chat. So just going back to Lorraine, would like to invite the Pillar Leads to talk about the application, what applications for patients there are for what they have learned so far. So Gavin, Naveed, and Ellen.
So one of our discovery is the taurine, the link with taurine, and so that is with now emerging data from our group and others, there's a clear link there with the microbiome in the gut and protecting the gut from protecting the integrity of the gut so that you don't get this leak into the systemic circulation that Leanna and us have shown. And so with that recognition, we've actually, and taurine as a biomarker for poor outcomes in patients with long COVID patients that have lowered plasma taurine levels. This has, of course, led to a clinical trial. I'm happy to say now that as part of the Reclaim platform, we now have Health Canada approval for the clinical trial. And we're hoped to start in September with our taurine trial. So we're very excited. Again, this is something started from very basic translational research and has moved relatively quickly into a clinical trial sponsored by CIHR. So this is really good news for a group and for for everyone, and Angela and the Reclaim platform and so on. So it's looking forward to getting this trial going.
Thank you. Thank you so much, Gavin. Naveed?
Yeah, I think like one of the things that we found, especially looking at diabetes, neurological outcomes, and post-acute myocarditis, risk is much lower among individuals who received vaccination. And that is like really key piece in terms of preventing the ongoing risk related to long COVID. So it's more around prevention. It may not be pertinent to the individuals who are living with long COVID right now, but it reduces the risk for future long COVID development. Another aspect that we see is the risk related to diabetes has started to come down. It's still higher. It has not come down to the completely baseline, but it has come down quite a bit, and it's close to baseline. So these are a few things that are directly applicable to the patients. In terms of healthcare utilization, that is more for the health system, and then thinking about how we optimize healthcare delivery, and that shows that the overall there are still like large number of large needs related to healthcare, and that we need to fill, and that is where like this health system optimization is needed from that point of view.
Thank you, Naveed. Ellen?
Yeah, I can touch maybe mostly on my work. So the two key areas I think that have the biggest impact on patients. One is we're working on some return to work options. It's specifically around the nurse workforce, but I think there's applications more generally. We've had a lot of conversations with patients about their needs related to return to work, and how the companies that employ them can better support that return to work. You know, like a lot of these return to work systems are very, you can't like go back and forth, and that doesn't often work for long COVID patients. It's either you're on work or you're not. And so, you know, chatting through possibilities for better return to work programs for patients has been enlightening. The other aspect when it comes to estimating the socioeconomic and healthcare impacts of long COVID, I think, is to really see where the burden is hitting patients. There's this assumption that it's all in the healthcare system, but a lot of it is burden within families, within on the patients themselves, within the workforce. So having that sense of where the burden is hitting patients, I think, allows us to better provide programs and provide help to those patients.
Thank you so much, Ellen. And then earlier question is also about the provincial billing codes. Angela, if you would like to address this.
Sure. So since 2021, there has we have been having specific billing codes for long COVID, and it's ICD codes, so it's used by all provinces. The issue is, you know, sometimes physicians or healthcare providers may not recognize that it's long COVID, and so may not click on that code. So that's one issue. And then the second issue is that people may not even go to the physician because they didn't want to sort of go and see someone about their issues, and two, they may be concerned that you know, there's a lot of stigma involved with long COVID. So so even though there are billing codes, it may not be sort of capturing everyone with long COVID.
Thank you so much, Angela. We are up to 1 o'clock Eastern time, and so this is the end of the town hall, I do see two last question. One is a very big one about whether we're expecting a surge of long COVID patients as a result of bigger wave. And the second one is to Naveed about patient currently living with long COVID. Maybe we could just, for those who are interested, we can stay a little bit for like 2 minutes to address these two questions. Naveed, would you like to answer the last one?
Yeah, so we haven't looked at the effect of vaccination on the patient who are living with long COVID. So we were looking at some of these effect of vaccination on long COVID and various outcomes. So that is, I'm not aware about the literature related to risk, but definitely when we look at the infection, vaccination reduces the risk of infection, and then ongoing risk for long COVID or exacerbation of symptoms related to long COVID with repeated infection. So that could be one of the ways that it reduces the risk. Yeah.
Thank you, Naveed. Angela, do you have anything to add?
There have been systematic reviews on this topic, whether long COVID, if someone has long COVID, whether vaccination helps with long COVID. So Akiko, a colleague at Yale, found that some people do improve. For us, in our CANCOF study, we found that a small number improved, most don't change, and a couple sort of like even smaller numbers got worse. So it's a mixed bag, but most people are not affected in terms of long COVID. But I would say that vaccination can have the effect of preventing future infections. And we do know that the more infections you have, the worse your long COVID is. We've seen patients who are recovering and then they got COVID again, and then they got worse. And so we do suggest people sort of taking preventive measures, not just vaccination, but like masking and things like that. And yes, there is a wave of a new variant that's quite contagious. Hasn't quite hit Canada yet, although like we haven't stopped seeing COVID, like we still have COVID patients, like fresh ones. But we haven't seen the spike. But it may be also difficult to capture the spike because people are not, really testing these days. So.
Thank you, everyone. And so this concludes our town hall for today. Just a final reminder that the registration for the symposium early bird timeline is ending tomorrow. We do have the option of virtual attendance, and the cost is significantly lowered to $5 for the patient with lived experience. So please feel free to check the link and register if you are interested. Thank you everyone for joining us. Have a great rest of the day. Thank you.